Here we have a 32-year-old woman who comes to physician with long history of depression, irritability, um, and personality changes. Her partner says that she has stopped engaging in activities that she used to enjoy, such as dancing, etc. Patient denies changes in skin pigmentation and says she has kept a balanced diet in low fat and carbohydrate. Physical examination shows jaundice and dark ring encircling iris of both eye, as well as hepatomegaly and gait disturbances. Follow-up test shows that there is normocytic normochronic anemia, no negative Coombs test, normal iron level, normal fasting glucose, elevated LFT and bilirubin, decreased serum ceruloplasmin, ANA negative. Which of the following is most likely diagnosis? Wilson disease, hemochromatosis, autoimmune hepatitis, non-alcoholic fatty liver disease, and primary sclerosing cholangitis. Okay. So the complaint here is of depression, irritability, personality change. This patient stopped enjoying the activities that she used to enjoy. There is also jaundice, dark rings around iris, and gait disturbance. Overall, on labs, you see that there is anemia and there is decreased ceruloplasmin. So, which of the following is most likely diagnosis? So you guys answered it as Wilson disease. So the answer is correct. And just review the topic for you quickly, so that I should be able to cover some important points. So basically, always remember, if there are hepatic symptoms, which may include hepatomegaly, which may include jaundice, or they may not give hepatomegaly jaundice, just say that there are changes in LFT. So if there is presence of liver symptoms plus neurological symptoms, basically neurological symptoms means if there is Parkinson's like feature, or if there is gait disturbance, or if there is dysarthria or things like that. And if there are psychiatric features, like if there is depression or even psychosis or any kind of this, you should quickly think about Wilson's disease. Um, So pathophysiology of Wilson's disease is basically there is mutation in ATP7A, I guess, gene. I guess A or B, I'm not sure. ATP7A or B, please check that. There's mutation in that gene, and basically because of that, the copper um, is not actually taken from liver to circulation through and ceruloplasmin is not formed. So copper starts getting accumulated in the liver, and after that start getting accumulated in rest of the body, including the nervous system and things like that. And that produces hepatic, neurologic, and psychiatric feature. A combination of these three in any question will point towards Wilson disease. Diagnosis of Wilson disease can be done by either measuring ceruloplasmin in circulation or 24-hour copper excretion in urine. So ceruloplasmin is going to decrease and copper excretion in urine is going to increase. Basically, copper does not bind to ceruloplasmin, and therefore uh, copper does not bind to its carrier and does not form ceruloplasmin. Therefore, you will not find ceruloplasmin in the circulation, and that copper gets actually excreted in urine. So diagnosis is either 24-hour urine copper excretion or measuring serum ceruloplasmin. Treatment is penicillin and trientering. So basically, these are chelating agent. So they kind of bind to copper and to the extra copper in the body, which is getting deposited in liver or a nervous system, and excrete them. Now, how I remember this as treatment is basically you remember 3 copper penny. So here we know that the problem is with copper. the mineral that is problematic over here is copper. Treatment is trienterine and penicillamine. So 3 stands for trienterine, and penny stands for penicillamine. Okay, just make it, yeah. So 3 copper penny. Try to remember this mnemonic, and you'll remember the treatment of Wilson disease, penicillamine, trienterine. Now, and there was this one feature. There was this one feature that was mentioned in the question, which said that dark ring encircling the iris. Can you please write in the chat box what is this called? Dark ring encircling. So basically, we know that diagnosis is Wilson disease, and there are dark rings encircling the iris. This, yes. So they are KF rings. So KF rings are pathognomic for Wilson disease. So basically, I myself, while studying, found it very confusing to remember certain feature that are seen in iris. So I tried to kind of bring them together for you. So there are 4 pathologies for step 1 that kind of point towards pathology of external eye. I have taken a few pictures to represent them so that you guys can have a good a good differentiation of them. So first is KF rings. So basically, can you see this yellow ring on outside of iris? This one. Let me, yeah. So this yellow ring is KF ring. It is due to deposition of copper in, I guess, corneal epithelium. And one question that usually comes up in exam is how will you diagnose this? So you do slit lamp microscopy. Sorry, slit lamp microscopy, and in that you see that slit lamp examination, and in that you see this clearly see this KF ring. Okay, is that clear? So KF ring is found one eye pathology, external eye pathology, is found in Wilson disease. Next comes yeah. Can you identify this? What this is? I'll expand it for you. Sorry. This pathology. Can you identify that? If yes, just put in the chat box. If no, I'll respond in a few seconds. I'm not sure if the figure is very clear, so I'll help you out. So if you can see this small arrow, so this iris is basically having these white spots, if you can see. So these are brush field spots. What are these? These are brush field spots, and brush field spots are seen in Down syndrome. Okay, not sure if I can write. Let me try. These are brush field spots. Brush field found in Down syndrome. Okay. Next, eye pathology is, what do we have? Okay. Okay. Can you identify this? What this is? What is this indicating? Okay. So these are Lish nodules. Can you please write in the chat box in which condition Lish nodules are seen on iris? Yes, NF1. So basically, Lish nodules are these brown, red, maroon nodules seen on iris. Brush field spots are grayish nodules or grayish spots seen on iris. Lish nodules are seen in neurofibromatosis 1. Brush field spots are seen in Down syndrome. Try to distinguish between them. Try to remember them. Yeah. So this is Acris senilis. So in Wilson disease, we see a yellow ring, yellow golden ring. In this, we see a grayish ring. So basically, Acris senilis is deposition of cholesterol related molecules around iris, and basically they are seen in old age. They can also be seen in hypercholesterolemia if in a young patient if they are having high amount of cholesterol, but usually it is seen in old age. So we saw overall four figures. Initially so there are two rings around iris. If there is golden ring, it's Wilson disease. If there is this grayish whitish ring, it's acris senilis. Then if there are grayish whitish spot on iris, it's brushfield spot seen in Down syndrome. If there are yellow, maroon, brown spots or um, growth on iris, then it is NF1. Is this clear? Cool. So I think this question, the purpose of this question was you being able to identify um, the diagnosis as Wilson disease. So I hope that you will be able to do that. And additionally, I just wanted to show you certain eye pathologies which are confusing.
Thanks for watching. Please give a thumbs up and subscribe for more.